Hi, I'm Dr. Joe Tregaskes. We're here in Richmond, Virginia, in the United States. I've been practicing dentistry for over 40 years, and it's amazing how things have changed in that period of time. Technology especially, as you all know, in the last several years has changed tremendously. I first got involved with lasers perhaps 15 years ago, and the particular laser that's here today, the Lumex 2, I first started using 10 years ago. And in the practice, we use it for multiple things. My practice primarily, I'm board certified in prosthodontics, and I'm board certified in craniofacial pain management as well as sleep disorders. And we use it in pain management. We use it to control pain, to stimulate healing. We'll use it for the temporomandibular joints. We'll use it for ligament and tendon injuries, also for nerve problems, muscle. All of these, pretty much anything where there's pain issues that we can use it. We also see a lot of degenerative joint disease in the practice, and we've done a lot with it there to try to stimulate bone turnover and new growth, as well as helping with the pain issues. Let's see, and in the prosthodontic side of the practice, we use it a lot prior to implant placement. We can stimulate the tissues before the implants are placed so that healing will progress more rapidly. So we'll see the patients usually a day, a minimum of a day before implant placement, and then the day that the implants are placed, and usually several days after. And the healing will progress much faster than it normally would. Extractions, the same thing. If we treat the tooth, the area, right after the extractions, we'll see that healing at 3 days looks kind of like it would almost a week later, if you haven't treated the tissues at all. Interesting with the implants though too, we've also used this particular laser in cases of failing implants. We've had instances where implants were meant to be taken out, and just as kind of like a research issue, the patients were referred to us to treat the tissues to see if it would help with the healing right after the implants were taken out. As it turned out, in several instances that we know, the implants were never taken out. We were able to reduce the exudate that was there and promote healing. In one particular case that I'm thinking of, we actually demonstrated that there was bone growth around the implants, and in all of these cases the patients still have the implants. I have a few that we've treated, and periodically the patients will come back. If the inflammatory response, these are primarily patient I'm thinking of particularly is a denture case where we have treated the implants. Patient leaves still wearing a denture, a removable denture that they take in and out, an implant retained denture, and then if the few times the patient has had a flare-up of problems, the patient has come back, we've treated it, and then she goes on for several months, and that's been going on for probably 2 years with that particular patient, that she's still been able to maintain the bone and the implants. So have found it to be an incredibly useful tool in our practice. In fact, I don't know how we would be able to really practice without it, whether it's in the prosthetic aspect of the practice, but especially in the pain aspect of the practice. We're using it virtually every day and almost every patient that we're seeing.